My name is Carl Marie Memnon, and I'm the president for the National Association of Health Service Executives, NAHSE, New York Regional Chapter. I am so pleased to see you all here this evening. For all our members and those joining us for the first time, on behalf of the board, Jay, Abigail, Christine, Max, and Maya, welcome to our meeting. We are meeting in unparalleled times. Typically, when we have our in-person meetings, we do go around the room and introduce ourselves. Since we are meeting virtually, I will ask all of you to just type your name in the chat box, along with the organization you're affiliated with. NAHSE is the premier health professional organization for Black healthcare executives. Our membership is vast, from the student population, early, mid, and seasoned healthcare executives. Currently, there are 31 chapters nationally, and the New York Regional Chapter, founded in 1968, is one of the 9 founding chapters. In addition to our 6 elected officers, the board of directors consists of 12 committee chairs. These chairs include individuals who support the chapter in various capacities. We have Orville and George, who are the audit committee co-chairs. Maya Williams, who also serves as parliamentarian, is the bylaws committee chair. Rashida Carter, communication and public relations chair. Abigail Namako and Dr. Charles Washington, who serve as co-chairs of the education committee. Christopher Chowdhury, finance committee chair. Okay Agboola, who serves as the health and community service committee chair. Aaron Hopkins, membership committee. Ramondi Thermidor and Steve Phillips, who serve as program committee co-chairs, as well as Raven Brewington, who serves as the public policy committee chair, as well as the Northeast and Midwest National Public Policy Liaison. Before getting started with the program, I wanted to thank our 2019 and 2020 institutional members, Elmhurst, Greater New York, Harlem Hospital, Health First, Hofstra University, Memorial Sloan Kettering, and Mount Sinai, for their continuous support of our chapter. This evening, we have a wonderful program ahead, which will be moderated by Russell Ashton and features guest esteemed speakers, Bashir, Agboola, and Chif, Umejei. Today's program is a testament of what we as a chapter focus on in terms of developing and elevating Black healthcare executives and fostering a community where Black healthcare executives can network and share in the New York region. Mr. Ashton is the Senior Manager of Digital Collaboration at Stryker. Russell leads a global team and manages Stryker's collaboration tools, call center, technology, email, and content management. Russ has worked in the IT field for over 25 years, primarily working for GE. He is an avid genealogist, former president of local Toastmaster organization. He has spent much of the time acting as a project leader for large strategic initiatives, including building the world's largest voicemail network, recently completing a 40,000 user migration to Microsoft Teams. He is a certified PMP and Scrum Master with certificate in Six Sigma and Teams deployment. In addition, he holds certificates in a host of other technology process management procedures, as well as a bachelor's in computer science from Fordham University. With that, I turn it over to Russell.
Thank you so much. Good afternoon, everyone, or good evening, depends on where you are in the world. I'm really honored to be able to come and host this event. I look forward to work with my fellow speakers as their moderator So I hope that we bring a lot of attention and energy. So just to get a view of what the team is about, I got a quick quiz. So again, anytime you have a collaboration where you get some senior leaders, such as Bashir and Chif, to be able to share their stories, we want to make sure that their stories can be tailored to what you need and where you are in your career. So with that, I have the first quiz of the day. Yes, you didn't think there'd be quizzes, and yet there are quizzes. So what you have the ability to do is if you take out your iPhone or your Android phone, turn on your camera, point it towards that QR code, you'll get the first quiz. And again, what we're looking to do is just to get an understanding of who's attending for today, right? I know we've got a really wide breadth of folks who get invited to this, and we're looking to get some of the feedback as to who's going to join. So go ahead and bring out your phones. I see a couple of folks looking down because they've already started putting in their very information. I see smiles. Smiles are a good thing when you are sharing content. That means that you are connecting with your folks. I'll give you another 10 seconds. 5, 4, 3, 2, 1. And really what this is about is to understand, we'll refresh, all right, so for answering the question, is this your first meeting? Oh, getting to it. So we've got some people who are saying no, so we got some folks who've been here before, and that's fantastic. And then we look at, will they be a member? I see a bunch of folks came back with the correct answer. Will you be a member after the session? Yes, lots of people are saying yes to that. So we've got some personal associates. This one, no retirees, a couple of students, some early careers, and just some guests who are coming for the first time. So that really does help for Bashir and Chif and I to understand who is going to be in the session, kind of tailor some of the content. And again, I really do look forward to having a great session with the team. So thanks so much. And again, we are going to be somewhat interactive. So we do want feedback. We want to be able to share. So what I'm going to do is I'm going to turn this over. Now, I always like people to introduce themselves. Particularly, it's a great way to see how they think of themselves for services. And our two content providers for this session have got a great story. We met on another session. We got to talking about one another. So Bashir, would you mind introducing yourself first?
Hi, good evening, everyone. So I'm Bashir Agboola. I'm with the Hospital for Special Surgery. I'm a Vice President, Chief Technology Officer. At HSS, I have oversight of infrastructure and operations functions, which really just means that the hardware, the technology, and software infrastructure that allows the business to do what it does in terms of providing technology. As you know, healthcare is tech heavy these days. I've been with HSS for about 6.5 years. Prior to HSS, I was with Memorial Sloan Kettering Cancer Center for a long stretch. I was with MSK for about 15.5 years. I joined them as a consultant, got converted to a permanent employee, worked there for a while, excellent organization. And when the opportunity at HSS came up, I moved to HSS to take on the CTO role. Prior to that, I worked with a consulting company here in New Jersey. I live in Jersey. And before then, I actually started my career in Nigeria, my IT career in Nigeria. But we can talk a little bit more about that as the program goes along. So it's great to be here. Thanks for having me, Carl Marie, and thanks for inviting me. And I love to continue to interact with the organization beyond tonight. Thank you.
Thank you, Bashir. That's a great story. So you hear where he started from. He did the flip from consultant to full-time employee. That's going to be part of a lot of our transition as we move from where we start in our career and moving to leaders. Chif, would you mind, sir, introducing yourself?
Sure. Good evening, everyone. And it's truly a humbling experience to be here in front of you. I'll kind of share what I do today. I'm the Vice President Clinical Systems for NewYork-Presbyterian Hospital. I'm part of a key project that we call Epic Together. We're knee-deep in the middle of our Epic implementation. So if you look above, you'll always find that with NewYork-Presbyterian, we're tri-branded with Weill Cornell Medicine and Columbia Doctors. And I think I can see a few NYP folks with similar branding that joined. I've been in New York Presbyterian for the past 13 years. I will go into some details about that as time progresses. I've had multiple roles in that implementation. My oversight for the most part is all clinical systems, which from all intents and purposes is the bread and butter of what we do. Prior to New York Presbyterian, I worked for a startup called Freesia, which was also in the healthcare space. And prior to that, I had different IT technology roles in mostly infrastructure regards to applications. Like my esteemed colleague Bashir, I also do come from Nigeria, and my career started in Nigeria as a student there. The one thing I'll add that's a little bit different, and I'll talk about that in more detail as we go on, is I have a little bit of an eclectic background because I'm both a philosophy major and a computer science major. And oftentimes people are like, that's two extremes of the academic pool, but we could talk more about it. Overall, I think I look forward to sharing my journey, my experience, and hopefully impact some things that I've learned that hopefully could help you in your careers as you develop as well.
Perfect. Thank you so much. And just to share a side note, when we were meeting together to put this session together, we were talking about two partners. So, you know, we both have direct descendants from Nigeria, and I'm a big ancestry buff with tons of 20,000 members of my genealogy folks. And I discovered I'm also about 30% from Nigeria. So it's a full Nigerian crowd today. So prepare for, I don't know what you got to prepare for, but prepare for something. So we have about 10 targeted questions that we put together for the team. So the way we're going to do this is we're going to ask questions. We're going to take, you know, like 2 minutes each to kind of go through those. If there's other things that come up that the team may say, hey, I want to either interject or I want to add more information, everyone has access to the chat. I'm monitoring the chat on the side. So if you see me looking up, I'm actually looking up at the chat for the session. So let's go with the first question. Again, this will do a bridge between where we are and where we were. What was your first IT job or otherwise? Or how did you prepare for your position today? So Bashir, I'm gonna go with you first.
Sure. Thank you. Thanks, Russell. So as I mentioned earlier, I'm from Nigeria. So I went to school in Nigeria. I started my education in Nigeria. I went to college to study computer science. I majored in computer science and economics. And at school, my first job was with a small IT services company. Now this was right at the early 90s, just to date myself a little bit. And at that time, there at least back then in Nigeria, the industry wasn't that matured. And so I worked in data processing. I did everything really, teaching clients how to use a computer, how to use a word processor, and I did everything that was required. And then I left the company after a short while, dabbled into software development. I had my own outfit, writing software for small businesses that could afford to have a PC at that time. And then I had the opportunity to move to a much larger company that was a large IT services firm, which actually the origin of that company, it used to be IBM. IBM previously owned the company before IBM divested and left Nigeria. In the 70s. So the company was, one that I'd, imagined I would want to work for even while I was in school. So I had the opportunity to work with them for about 5 years. And then while I was there, I interviewed for a job here in the States, a consulting company based in Jersey hired me and facilitated my move to the United States. So I worked for them as a consultant, and MSK was one of our clients. I worked at MSK for some time, and I had the opportunity to get converted with the permission of my company to an employee of MSK. And I mean, I see some folks from MSK on the call here. It's a wonderful organization, same as NYP and HSS. Really great healthcare organizations, great companies to be part of. I was able to grow professionally in that company. I quickly moved into management. I, had lots of support. Got my MBA while I was at MSK. I went to Rutgers for my MBA part-time. Had tuition reimbursement to thank for that. I took advantage of it. I had some certifications in Nigeria before coming, but at MSK, again, had the opportunity to take lots of classes, improved myself tremendously using resources and support of the organization. And that really helped prepare me for my, the senior roles that I've since assumed. And, I'll be happy to talk a little bit more about that as we go along.
Perfect, thank you. I love how you threw in at the very beginning of your career, you were still teaching and letting people share your knowledge. That's great. Chif.
Sure. So I'll probably start with my Nigerian story as well. Not sometime in the mid-90s, my dad was looking for something to invest in. We had a relative who had gone to University of Ife, one of the prestigious universities in Nigeria, who came back and said, listen, computers are hot. We have to figure out what to do with computers. So my dad had some money on the side, got some friends, and they decided to put together a computer outfit. At that time, I was just about finishing up high school, or secondary school, as we call it back home. And he was like, well, why don't you come in and get involved in this computer stuff? So the first thing is we have a prospector who has no idea what he's doing with a computer. Until this day, he still doesn't. But he took the risk to try to invest in that. So my holidays, vacation time was typically spent working in my father's outfit, where we started teaching people how to do word processing. So I learned from the teachers, and very quickly as I graduated secondary school, began to teach Fortran, GW Basic, and WordPerfect. Looking at some of the folks on the Zoom, they probably have no idea what I'm talking about. But these are some old software, to put it that way. I started my first year in university in Nigeria, Edo State University, Agboola, as a business administration major. And somewhere in my second year, my family immigrated to the United States. So I came to the US. One of the things, those of you who are first generation immigrants typically know that your career decisions are oftentimes told to you. You don't necessarily need to pick it. They tell you what you're going to do, and you either do it or don't. So I was kind of told, we started the computer thing, let's stick to that. While taking some of my liberal arts classes, I fell in love with philosophy because I like to ask questions and I like to question why. You can imagine that gets me into a lot of trouble with my father and my parents, but always questioning why. So I ended up being a philosophy major. The day I told my dad and my mom that this is what I was going to do, they looked at me and said, so who's paying for that? I said, well, we'll figure out a way to do both together. I'll tell you, and why I start with that is my first year, I got a job working for a company called Phipps Houses. I was using the experience I had in Nigeria. It was a very straightforward thing. I came in saying I was going to be information systems major. They gave me a job. I did desktop. I became a DBA, and I did throughout my college years. I worked full time for them. So I went full time school and I double majored while I was in undergrad. When I graduated, I got an opportunity with a company called Seedco, also in the nonprofit sphere. They did a lot of earned income, earned benefits for affordable locations. It was a very good experience, became a systems administrator. Essentially, we worked on the back end. So before I'd done mostly databases and build, and now I was doing more how people authenticate and how people share services within the environment. While in there, one of the things that happened with my family was, as first generation immigrants, everyone is trying to figure out how to survive. So everyone ended up going into healthcare. My parents migrated as well, and they became healthcare professionals. They both became nurses. So in our fourth year in the US, you had myself, my parents, and all my siblings, 5 of us, all pursuing some healthcare degree. I was the black sheep still doing this computer science philosophy thing. And then I got exposed to a degree in informatics at SUNY Downstate. When I got there, it was kind of the bridge from the computer science aspects to the healthcare aspects. One of the things I particularly loved about being in Brooklyn was a lot of the people that attended that program had similar stories like mine. They were all first or second generation immigrants. There were people trying to make a change for themselves. While there, I worked for a company called Frisia. It was a startup. I was employee number 1 outside of the 2 founders. Happy to say they're actually now publicly traded on the stock exchange. And frankly, I didn't make any money out of it. But worked with them for a year. We did a bunch of implementations nationally. And then I went on to pursue a doctorate degree. While I was focusing on my doctorate, an opportunity came at NewYork-Presbyterian to do a project manager for barcode medication administration. One of the themes that I would like to share is up until that point, and from that point moving forward, I normally crack the joke that every job I got after that, I was not qualified for. I had never been a project manager in a formal way. I had never managed, I didn't even understand what I was supposed to manage was barcode medication administration. Who knew what that was? And over the 13-year journey, it's a trend. I ended up taking positions that probably I may or may not have been qualified for. But some good element of luck, hard work, perseverance, and having the humility to accept what you don't know has guided me through, and fortunately for the 13-year journey, which I can go into more details over time at Presbyterian, you'll see that no matter how hard it was, we figured it out and it worked out, and we did it again and we did it again. Good teammates, having that gumption to take the risks, and also the humility to accept what one didn't know got me to where I am. About a year and a half ago, I was made a vice president at NewYork-Presbyterian, which I think has been a great story so far, 13 really, really good years. But nothing can replace the people that I've met along the way, the different mentors I've gotten along the way, whether they be very senior people or people in other roles that people may not consider senior, and leveraging all those experiences has got me to where I am today. And hopefully it will get me to where I want to get to. And I can share more of that with all of you.
Perfect. That was a great overview of your story. You know, if I look through, I'm just taking notes as I just out of habit. And yes, I do know what WordPerfect is. I used it a long time ago. It was an awesome thing. So at your very beginning of your journey, you focused on teaching. You mentioned you taught people how to do something, which is one of the things that you did throughout. So I think that's great. So when you're looking at teaching and learning, one of the things that I think that happens, particularly for senior leaders, is you've got to be able to share your story and make the story relatable to senior leaders, to people who are your peers, and as well as for your team. So Bashir, I got one for you. What's your communication style when working on a particular issue or in communication to your team?
So communication, there's no simple answer to that. And the reason I say that is I tailor my communication to the context. I tailored my communication to the audience. Remember that the reason we as human beings communicate is to get something across, right? And when you have in mind, well, so let me take a step back. So when you communicate with someone, irrespective of the medium, whether it's a written communication or verbal communication or any other expressive form that you choose to use, your goal is to pass a message across. So my effort has always been to look at what message am I trying to pass across, and then trying to use what I deem to be the best method or tool to get that message across. So for example, if I'm dealing with an executive that I know tends to be, short on time and, agitated and direct and to the point, then I know to make my message very crisp and direct, respectful of their time, and recognizing that their temperament would be such that they would not, they would not put up with a long story, So I go straight to the point. And then in other contexts, I become a storyteller. I love to tell stories, as you can tell from my response to your question. I'm telling the story. So sometimes, and actually, you'd hear this repeated quite often, that leaders need to be good storytellers. You have to be able to tell a story. You have to be able to frame whatever your message is in a story. One, stories are captivating, and stories convey in a better fashion the message we're trying to put across. But some people don't want you to tell a story. They just want you to come, tell them what they need to know, and you move on. So my communication style is one that starts with trying to understand the person or persons, the audience that I'm trying to communicate with, recognizing their communication preference, and tailoring my message as best as I can to their style in order to get the message across. But if you were to ask me in general, I can sum up my communication style as being fairly direct, with a mix of stories that are designed to make my message easier for my audience to understand.
Well, that's great. I absolutely agree with you. You have to look at the circumstance and learn by your audience of how you're going to communicate. So Chif, what would you say is your communication style? Like, are you direct? Are you open? Do you want a story? What do you think?
I think all of the above, depending on the day. And I think I want to harp on something that Bashir brought up. It's all about the context, and context is the environment, the situation, and the individuals involved at that moment. Listen, if we're in a chaotic situation and we need to make a decision and move quickly, then I'll be direct, straight to the point, almost authoritarian. And I think that's not a bad thing. That's just what that situation demands at that moment. For the most part, I would say that I typically like to have a collaborative style, where whether with peers or teams that I'm responsible for, where at least from that level down, where we can share ideas, where we can go back and forth and discuss options. With those who I am accountable to, just like Bashir, it's a matter of being cognizant of what is their communication preference. I think the theme that you'll get from what Bashir and I are saying is there really isn't one style. Just be aware of your environment, who you're communicating with, and tailor your communication to match them. One thing that I'll tell you is a lot of things break down because of poor communication. It's not that you're not saying the message, you just have not delivered it in a way for it to get maximum impact. So effectively communicate for impact and know what impact could be. There could be a moment where you might say the one thing in that meeting that you know feels like you rolled a grenade in the room, but if the impact is to get everybody jumping on that grenade, yell grenade. If that gets you your desired impact. If your desire was to be aware and you roll a grenade in the room, you've just over communicated and caused something. So that's something that I think everyone should look at. No one has mastered it. There is no one that has it right. You will get it wrong a few times with certain individuals, and then you'll figure out how best to adjust. That's my take on communication.
So Russell, I'd like to, because as Chif was speaking, a couple of thoughts came to mind. When I speak with other professionals, or when I mentor younger professionals, I try to emphasize that in terms of trying to figure out where to people would often ask you, what are the things I should do to be a better professional? What should I study? What books should I read? What classes should I take? one of the areas I always advise people to focus on is communications. And communications, not just the quality of your command of the English language, which is important, or any language that you speak, it's important, but also the contextual element, as Chif was describing, of what to say, when to say it, how to say it. I've seen so many careers derailed by people, sometimes very senior people, not knowing when to say something, or saying it in a way that would, it becomes that grenade that then creates chaos around them. So communication is really very important, and I just feel we should emphasize that as part of development. And one of the fortunate things that I think I had the opportunity to do as part of my career development was to recognize that very early on, and to focus on development in that area, taking classes, reading books, listening to senior leaders, people that I recognize as very good at it, both in terms of their form, how they present, how they speak, and what they say. So I think that's really very important to focus on as part of our overall professional development.
I think that is really great. And I see a question that came in that I think ties to this, and I'll let either of you two take this one. Can communication style be tied to emotional intelligence?
I'll probably take a stab at this. I would say absolutely. Emotional intelligence is effectively situational awareness. And oftentimes you think about EI, or people talk about your EQ based on people. That's one strong element of it, because you are communicating most times to an audience, and the audience are humans, right? So focusing on what's the tone, what's the mood, what are the nonverbal things that they're doing is important, but it's not the only thing. Sometimes the word you say actually creates the situation, which is why I use with the rolling grenade scenario. You could go into a meeting and say, well, I don't know, our audit is going to fail with a bunch of senior executives, and what do you think is going to happen? Everyone is going to get agitated. If you phrase it like, I think there's an opportunity for us to improve in this area of an audit, all of a sudden you might get constructive help than you need versus a destructive help. So EQ is important, emotional intelligence is very important, but again, think about what is the impact. Every time you go to communicate with any group, whether it's your peers, teams that you may lead, or people that you are accountable to, have the goal in mind, be intentional about your communication. And if you are, then that gives guidance on how you deliver your message.
I'll add to that by saying communication absolutely has to do or is influenced by emotional intelligence, right? So situational awareness, social awareness, self-awareness, knowing yourself. And I said, when I've had the opportunity to mentor maybe some of my team members that have had some struggles with temperament, I would say anytime, maybe it's a team member that tends to say very abrasive things in meetings or rub people the wrong way, and I would say, you know what, you need to understand yourself. And when you get angry, actually before you get angry, there's certain physiological changes that's happening within you, and you can actually anticipate that beginning to happen. Kind of like the Hulk, right? He knows it's coming. So maybe there's some breaks in there. So that speaks to the self-awareness, knowing that if I put myself in this situation, or if I start feeling this way, I'm likely to say something that I should not say. I'm likely to respond in a way that I shouldn't. So having self-awareness, it's part of emotional intelligence. Having situational awareness, you come into a room, You know, everybody looks serious and gloomy, and you don't come in and you don't start cracking a joke. You know, it just might not be the right context to crack that joke. That joke might fall flat, might actually be offensive, depending on what's going on there. So having this situational awareness, social awareness, knowing how, you know, things are regarded in any society, any context, and this tends to sometimes trip folks like myself up a little bit. You know, I didn't grow up in the States. I grew up in a different culture. So sometimes when you come into a different culture, now it could be a different societal culture or a different organizational culture. Maybe you've spent a long time in one company. I spent 15 years at MSK. Now coming into another organization, yeah, the new organization might have a different organizational culture. So having enough self-awareness to know that, you know, perhaps what's acceptable in one organization might not be that acceptable in another organization. So that's all part of you know, being emotionally intelligent and then tailoring your communication appropriately. So I think that's really, it's a really great question that was asked there.
That's great. I also noted that both of you mentioned classes. Both of you mentioned joining organizations. I was a Toastmaster, and the reason I joined Toastmasters, I couldn't communicate well to my executives. I had great ideas, but if you have a great idea and aren't able to articulate in a way that'll be consumed, that's almost the same as not having an idea. So I like that both of you mentioned taking classes, being aware, making changes. So as we look at where we are today, let's throw in like a COVID question. You both mentioned learning. What did you learn from the COVID response about your team and their capability? And whoever wants to take that one first, you can take it.
Sure, I could go ahead and take that. I will say, what did I learn about COVID is, let me put it this way. I think I probably took equivalent of 100 years worth of human behavior classes in the singular month of COVID. And the reason why I stress that is I'll talk about some things we did really well, then I'll talk about some things we didn't do well, and hopefully that story pulls it together. So, you know, naturally, people were afraid. And in the middle of COVID, people wanted to go home and people wanted to quarantine, as has been dictated by all the government health agencies. But we work in healthcare. And, you know, one of the things that NYR-Presbyterian prides itself with is being #1 in New York for multiple years. So if our city was going through a pandemic, what does it say about the #1 hospital, you know, in New York, if our staff are skittish about taking care of the city that gave us the right to be called #1? And it's a very interesting conundrum that we're in, because from a staff perspective, there's personal safety. There is also the concern about duty or social duty. And people were put in a very hard place of deciding between their families, their local social structures, and their greater responsibility. Now, one of the things I will say that was great was in the middle of the pandemic, we stood up the Ryan Larkin Field Hospital. Some of you may have seen this in the news. There was a whole big bubble over a field in Colombia. That, let me put this in context. That was a 300-bed hospital that was stood up in 5 days. Now, you would say, well, maybe they just put a tent and they put beds in. We had every piece of equipment you wanted. We actually went live with Epic in the tent. And to make it even more hilarious, the workforce was not our workforce. They all came from out of town. So think about this. Most technologists see themselves as technologists. We're part of the healthcare struggle until we're told, well, guess what? You have to put this up in 5 days, leave your homes, come into a tent that is guaranteed to have COVID positive patients. So this is not a case where you're not going to be COVID positive patients. You're going to stand elbow to elbow with a doctor in a bunny suit, train them while they're taking care of a patient. Now, we had several hard conversations, but let me talk about the success. 5 days, 300-bed facility was built. close to about 200 volunteers were trained. Not one member of our team contacted COVID, and we allowed those volunteer workforce the ability to take care of our city, our loved ones who were in there, our neighbors. So I learned that people will always think about how things impact them. I learned that communicating with people about our responsibility to our community was important. And despite those struggles, one of the things I could say with a straight face I learned from my team is they rocked it. They came in and they delivered. It was painful, but they absolutely delivered. One of the other things we'll talk about is we had several ORs while in the middle of COVID, we had to convert into ICUs. And those decisions were made at a drop of a hat. You come in at 7 a.m., half your team is home, and by 9 a.m., they have to find a way to get into the city and convert an OR so that they can begin to see patients by noon. And sometimes before noon, they're told, you know what, maybe it's not that OR, go to the next OR while you're halfway through that work. So I learned that people are resilient. I learned that in spite of people's fears, if there is a compelling goal, people will rally. And the one thing I will say is, when I go back to Ryan Larkin, of all the work we did with converting ORs and sending a workforce home that we hadn't had and getting infrastructure up or provisioning access for so many people, one of the things that resonates for me is we communicated what we had to do. People voiced their concerns. People were vehement about their concerns. And fortunately, we were able to give them a compelling enough message. Most came on board. There were some who didn't, and that's fair. And they have legitimate reasons for it. And most came on board. The other thing too is in times, pre-pandemic times, half the things we did in a month, we would never have accomplished in 5 years. Most people will never come together. Most of the politicking and joking about who has controls what assets and why we shouldn't do this should not happen. And in COVID, again, 300-bed facility, multiple ORs converted. We took an entire workforce remote. We also went live with Epic a month earlier. And so if anyone could sit back and say, well, despite all the problems, what do I have? I am the luckiest person to have the team I have. And hopefully they feel that. And I know that they think words don't mean much, but very, very lucky.
Yeah, I'll share some of that sentiment in the sense that, you know, we at HSS, we're regarded as an elective care hospital. We're a specialty care hospital. We're regarded as elective. So one of the things that happened to us much earlier, actually, we decided even early before the state mandated that all elective procedures should stop. You know, if you all remember back in March, because there was concern about running out of PPEs and medical supplies. And so, and we also, as socially responsible, as a socially responsible organization, had also, our leadership had decided that we needed to do that. So, and then we also wanted to free up capacity to be able to take in the anticipated surge of patients from NYP, because they are an acute care hospital, so they would take the COVID-19 patients and take care of them, and we will take the spillover or the other patients that they would not have time or the capacity to take care of. So we did that. But prior to that, the IT team and parts of our the infrastructure team had actually started work in late February into early March, even as everyone was talking about how bad this could be. We had to quickly begin ramping up our infrastructure because we anticipated that if you were going to send people home, they need to be able to do remote access. You're going to need higher internet bandwidth. Many folks don't have laptops that they would need to use from home. So we were already ramping up. We bought hundreds of laptops. We had to quickly upgrade our internet bandwidth that we had scheduled for later in the year, upgraded some of our core infrastructure, network infrastructure, just to make sure that when folks began working from home, we could support them adequately. And we went from having at any, on a regular day, maybe 100 people, a couple hundred people working remote out of our 6,000 employees. We went to supporting a third of the company consistently for several months, working remote. And then importantly, many of our team members had to be on site right there with the caregivers. Because again, the caregivers are there. I mean, they're scared as anybody else is, but they, particularly when we began taking in COVID-19 patients, because after a while we say, you know what, we're going to do what the other guys next door are doing. We're going to start taking in COVID-19 patients. So we also converted ORs to ICUs. We did all of those at breakneck speed. And, our team had to be there to support the clinicians. Now, folks were scared, and rightfully so, but they, put the fear aside and jumped right in. On one hand, I'm really blown away, but on the other hand, sometimes I think about it, I say, you know what, healthcare has always been a mission-driven industry, and for the folks on this call, you're all from various healthcare organizations, and you get it, you understand. In healthcare, we're mission-driven, so that probably explains the commitment and the passion that we saw various teams put into the response to COVID-19. So coming out of this, honestly, I think it strengthened the bond within our organizations, within our teams, because people actually came together, put aside, the departmental silos and the bickering that you would normally expect from one team to the other, and just got the job done. Now it was a lot, and it people probably feel burnt out still, but at least that's one big blessing coming out of a really bad situation that the country was in or still is in.
No, that is great feedback, and I think hearing both of you talk about the transformational story where, I think Chef said it was the politics was gone, right? The output was measurable, and you were going to get this thing to happen. Even in where I work in Stryker, we moved thousands of employees to be able to work from home instantly, relying mostly for cloud services, right? We were like, okay, what can we build? What can we acquire? And the goal was, you have to make sure we still deliver the services, whether it's direct to customer, whether it is the equipment that will eventually go to customer, and still get those delivered. I think that is a great story and a testament to the teams that we have built once our 3 organizations. So I think that is fantastic. So I got another one. So this one is going to probably tie in a little bit to it. How do you know a project is successful? Now, I think we just talked about some really great projects we did with no preparation, but in general, for our partners, particularly someone who might be starting in their career and would want to know, how do I know I'm doing this project and it is successful? And you both have talked about some really good stories of going from a startup, leaving your home country. From your perspective today, what would you tell yourself that you didn't know back then, and you tell for some of our members here, what would you tell them? How do you know a project is successful?
I'll frame it simply. Even though I'm a PMP, I studied project management and got certified as a project manager several years ago. I never really worked as a full-time project manager, but as part of my career development, I thought having that background was important, and it turned out to be. I'll give a non-technical response to that. I'm not going to answer as a project manager. I'll answer in general. So how do you know if a project's successful? Well, if it meets the requirements set out by the stakeholders as defined, as defined in the scope that you put together at the beginning. So this speaks to one key point. Any effort that you're trying to do, whether it's defined as a project in the formal sense, and it's time bound, and you've identified what needs to happen there, the key requirement that you should always have whether it's your boss telling you to go do XYZ, or on the other hand, you asking your team members to go do ABC. It's really important to identify what needs to get done and by when. It seems very simple, but I tell you, probably nothing trips up a professional more than that. Because if you're asked to do something and the scope isn't clear, or the scope keeps changing on you, and you lose you lose sight of where you were supposed to go, because along the line additional requirements were thrown in, and you're bound to fail. So I would say the way I know that we're on track, or we've met, well, we're successful, is one, if the degree to which we've met the defined scope. And if the scope changes along the line, well, then we redefine what we're doing and we adjust as such. So the project's successful when you've met the defined scope for that project. And of course, there are other elements of, okay, have you met it to the degree, to the quality that's desired, to the cost that is required for you to meet that requirement, and within the time frame that it's required. So there are all those elements: cost, scope, quality. But ultimately, the stakeholders really want something, and the degree to which you meet their requirement is the degree to which you're successful, bearing in mind all those other factors as well.
Yeah, I think Bashir summed it up well. He took me back to Pinbock and Prince too, with some of the definitions. I think the one thing that I'll highlight that Bashir said is, I'll paraphrase, is getting it done to the satisfaction of whoever is sponsoring the endeavor. You know, one of the things that's very important is scope. You can't, it's easy to say, yes, this is what we're going to achieve, but the question is, what are we going to be measured on, and are we going to achieve the benefits of the said project? So let me use the big one. We did Ryan Larkin Field Hospital, 300-bed facility, couple of $1 million. The goal of that was to be able to send patients in our overflow that are going to be recovered to a place to recover before we send them home, so that more acute patients could be in our facilities. From that, did we accomplish our goal? Yes, we built it up. Yes, we saw patients who were on the tail end of their COVID journey and they transitioned out through there. So if you look at that very simplistic goal, we accomplished our goal. Someone could look at it from a different lens and throw in some of the constraints of cost, time, and quality. And then once you put cost in it, you say, well, perhaps the project was not successful because we spent X number of dollars. But the key to defining the success is, what was the goal? If the ultimate goal was to get patients through the tail end of their journey, through a facility and back home, then we accomplished our goal. So I use that as an example to say, hone in on what is the measurable benefit that the project is supposed to give. And the other thing I'll add for anyone looking at projects is, if you're leading a project, you're participating in a project, identify very quickly, very early what that baseline is. And when you want to show that you've added value, show that you've moved the needle or not to what that baseline is, as long as it aligns with the measurable benefits that is expected from it.
I think that's great. Now, what I also heard, I don't know if anyone else heard this, but Chif, you're a PMP?
I am PMP in Prince 2.
All right. Bashir, are you a PMP?
Yes, I am.
Who told you to become a PMP?
So for me, the story started actually maybe, when was this? In the early 2000s. So I was debating at some point, should I get an MBA? Should I get a PMP? Because at that time, that was shortly after I joined MSK as a full-time employee. I was a sysadmin. I was a systems admin. I was a Unix admin. And I knew what I wanted. I knew I wanted to be in management and in leadership roles. And so I was debating, what should I do? Because I had a bachelor's degree and I had a master's degree already, both in computer science. And I was saying, should I go for my MBA now, or should I get a PMP Not because I wanted to be a full-time project manager, but I wanted some of that education. And then I also wanted the creds to be able to say, hey, you know, yeah, I'm not a manager, but I do know a thing or two about managing people and effort. So I decided, you know what, I was going to do it. So I went ahead, got the PMP. Actually, before then, I joined PMI, which is one other thing I would advise people to really think about doing, you know, professionally. I joined PMI back in, I don't know, maybe 2003 or something like that. At the New Jersey chapter, I'll go to the monthly events. You know, I would network, I would meet people, I would listen to the monthly presentations by experienced project managers that would come. And, you know, that was great education for me. You know, that was really great education. I would pay I think the events were 20 bucks, you know, for the monthly meeting. You had a nice dinner at a hotel somewhere in Edison, New Jersey. And, you know, you cocktail hour, you network, you sit down for dinner, and then this experienced project manager would come up on stage and talk. And I learned quite a bit, you know, not just about managing projects, but also just, you know, being a good professional. So I did the PMP, and then shortly thereafter, I went to school for my MBA. So I ended up doing both, and I think it's been helpful to me.
I think the one thing I'll say, and I see that this is a predominantly ethnic minority crowd, is when my approach to credentials is you won't outwork me and you will not out-credential me. And every excuse that anyone would have to say you are not the person for this opportunity, I will do my best to remove it for you. I'll assume that you're biased and I'll do my best to remove it for you. Here's the thing. There's quite a few certifications out there. You know, PMP was the flavor of the 2000s. And if you looked at European opportunities, Prince 2 practitioner was a flavor for that for project management. The bottom line is there's always going to be the next new certification, credential, degree. What stops you from getting it? That's the fundamental question. What really stops you from getting it? So my thing to all of you, and I say this to anyone I care about or love, is don't let anyone out-credential you. You know, if I walk into a room, what I want to be able to say is when I speak and you say, who's that person? Go look me up. And when you look me up, you come back and say, oh, he earned the right to be where he is. There's a tendency for folks who are ethnic minorities when we are at the seat for people to assume that your company picked you because you're meeting a quota. You're in your seat because whatever spectrum of diversity is the flavor of the hour is what they're trying to meet. I feel strongly that there's no reason if I get there because you're meeting a quota, great. But the credentials that are behind my name would support that. So that's the one thing I want all of you to kind of think about is don't let people out-credential you. It takes nothing but effort. Effort is cheap. Most of you work for institutions that will pay for your education. And if you don't, try and get into some of those institutions. Why let that benefit waste? Take it. You know, I'll tell you, there was a 3-year streak where I took 9 certifications, and you know, I was like, well, if you guys aren't going to stop me taking them, I'm just going to keep taking them. Do I need them? I don't care. I'll just add them in there. One of the things is no education is wasted. What you learn is valuable in one way, shape, or form. So forget about just amassing credentials for the sake of credentials. Every time you get into a classroom, every time you hear someone speak, every time you talk to someone, you hear information in a slightly different way. It's not like they're saying 9 or 10 things are saying are new. It's just a different perspective of information. That is valuable. So if you can enrich yourself, enrich yourself. And if a credential is going to help you be in that room, establish the credibility you need to get where you need to go,
Yeah, and thanks, Chif, for mentioning that. I'll tell you, I remember back in Nigeria when I worked for, I worked for the company called DPMS. That was my last job in Nigeria. DPMS, it used to be IBM. I worked there a number of years before I had my first opportunity for a company sponsored training. You know, I was really happy, and the company sponsored me to go for to take some classes at IBM in South Africa. So I went from Nigeria to South Africa. I was there for a month, took a bunch of classes. So when I came to the States, and I was fortunate to get employed at MSK, and MSK was very generous with training and education of employees. And even when I became a manager, because I became a manager fairly quickly there, I was amazed at how often people did not want to go to class, except perhaps if it's a conference in Vegas. You know, there was training budget that would often go unutilized every month. And I was just blown away. I mean, I took practically all the classes that HR offered in the organizational learning folks in HR, the negotiation class, the motivation class, the presentation class, the business writing class. I took practically all the in-house classes, those 1-day, 2-day classes that HR offers that doesn't cost, there's no budget for. Your manager just has to let you go. I blew through their catalogs. I took all those classes, that doesn't require any budget. Your manager just needs to let you go. And then I would take all, the Unix class, the networking class, the security class, and I did a bunch of certifications as well. So my point with that is, let us take advantage of the facilities that our companies provide, tuition reimbursement. I don't see why you would let that money go to waste. If your company is going to sponsor that, bachelor's degree that you never got around to take, or the master's degree that you've always wanted to have, take advantage of it and let them pay for it and go on their dime. It's granted you'll have to shell out a little bit of money, but absolutely take advantage of that. You thank yourself later.
So the reason why I asked both of you gentlemen the question of who told you to get your PMP, the answer was no one. You took the initiative yourself for self-improvement. And no one was saying, hey, it's a 4-hour class, can you do it in a week? It was, you wanted to do that to differentiate yourself from, not necessarily your colleague, but differentiate yourself from what you were doing at that time. And so I thought that was when I was going through your bio, so that one was a really good one to share, because it's one of the hardest steps you'll probably do because it's a singular day. But it shows your commitment to change from where you are to where you want to be. And then also, if you look at these two gentlemen, you'll see they also put in numerous other certificates, because they took the time to go through the multiple certificates and learn some things. So one of my best practices is, if I get a large project, I get a certificate in whatever tool or project that I'm releasing, right? This way that when you have a meeting with your leaders, you can say, oh yeah, I've got a certificate in, I don't know, DBA release for migration services, or if you're doing a Power BI release, or if you're doing something specific. And there is always, Chif, I think you're right. There is always, and Bashir, there is always leftover money for training. It is one of the hidden secrets of the corporate world. And if you time it right, typically you can get that kind of training included. So that's great. Now, I know we're at the 7 o'clock mark, and I just want to be conscious of time. So I know we're going to go to some of the Q&A from the guests. I see we have 3 particular questions. I think one we tied in already. And then I just want to get to this other one. So the topic of communication is key to healthcare at NYP. Is technology a part of the discussion to address racial inequalities, particularly in the Black community?
So this is a very good and timely topic. Given all the social events that have occurred, in terms of all the unrest that's occurred over the past couple of months, one of the things I'm very, very proud of what NYP has done is they have taken frankly, the most aggressive stance I've seen in terms of a zero tolerance or an enlightenment campaign for the staff. Now, we're doing a ton. We've just recently opened up, and today was the inaugural session, a Center for Social Justice, which is led by our provider, Julia Iyashere, which is a big step. And the goal of that service is essentially to look at health disparities and how we can improve them. From a technology perspective, one of the big things we started doing was we started, as these conversations got heated or got more limelight, we started thinking, what assumptions do we have in our algorithms that we use for clinical decision support that may have implicit bias in them? So we found several scores and scoring systems that we use that look at kidney function that for some reason weighed, if you were African American versus if you were any other group differently. And we had several clinical conversations about how relevant these were. Most of the time, the literature did not support the assumptions made in these, and then we corrected those scores. So how are we doing this from a technology point of view? Multifaceted. One, the Health Justice Center will help from policy and social outreach. Two, looking at the algorithms and making sure that we've removed where we can and where it is clinically safe to do so, implied bias in clinical care. Three, we're looking at different programs in our outreach where we're providing technology to underserved populations. So we've been pushing very aggressively, we want to, but even if we didn't want to, COVID fast-tracked everybody to go telehealth. And one of the things, if you look at some of our populations that we serve, those populations may not have access to internet or may not have access to phones or computers allow them to do their follow-up care. And we're doing a lot of programs where we're going to be giving out, where we can, some affordable technology to assist. Now, I will tell you, despite all these efforts, there is nothing that helps with the fight of inequity than the introspective look. And by introspective, I'll quote, I think Marcus Garvey said this in Nova Scotia, and Bob Marley kind of repeated it: emancipate yourself from mental slavery. None but ourselves can free our mind. And what that is each one of us, as we educate and we deal with our colleagues, our allies who may be of a different hue or a different diverse origin, need to look introspectively at how we interact with others and make the adjustments as we can. So that's what we're on the technology side. We are doing a very aggressive hearts and minds campaign, looking at implicit bias across. It's now required training, and we're doing it monthly. So it's been pretty aggressive. Some would almost argue that it's a little too much for some, but it's been very, very aggressive, and I'm very proud of our institution for doing that.
Great. And then we have another question. Is the technology gap now a health disparity? Bashir, you want to take that one?
I think it is for the reasons that Chif mentioned, and then some of the more obvious reasons in terms of access to technology. So if, for example, during the pandemic, all healthcare institutions reported a spike in telehealth, which was a great thing. Even at HSS, we had struggled with telehealth for quite a while. And I'll tell you, in the first week of March, we had maybe, I don't know the exact number, like less than 200 telehealth visits a week. And then 2 weeks later, by the third week of March, we were up to about 1,800 telehealth visits a week. And then it went up from there. And this wasn't a unique phenomenon at HSS. It's reported universally, particularly in the Northeast during the spike that we experienced. And now it's come down somewhat. But my point is, imagine that if it's a household that's really on the the lower spectrum, economically speaking, and maybe they don't have internet service at home, maybe they don't have a computer or even a smartphone with a webcam. How would they be able to access telehealth, even if maybe they're on government-sponsored healthcare programs? How would they have access to that telehealth program if they are digitally disconnected from the service? So technology absolutely does play a part. And then as we begin to talk more and more about things like wearables being part of virtual care, wearable technologies, whether it's your smartwatch, whether it's even your smartphone or other gadgets or some rings that you can put on that can track your sleep and all that. Well, those are things that cost money. So one of the things our company is talking about, and I think this is in this discussion is with Google or one of the other technology with Apple, is to actually provide the smartwatch to some patients to take home as part of that program. And I'm sure many other hospitals are thinking along that line of having programs where they would actually provide the wearables to the patient to take home with them, because without that, many people will not be in a position to buy the technology that would allow us to extend care into their homes. And so they will be disconnected from this evolution of care that we're witnessing now.
That's great. I'm glad we're able to talk through that. And yes, I think there is a clear disparity for some folks, but it's the effort you take. And the challenge is that institutionally, some people just don't have access to thinking about the way that they could have access or they could do something. So I think that's going to be one of our biggest challenges. Now, as we talked about the individuals who are at this meeting, we talked about credentials, and clearly you two gentlemen have a bunch of credentials. What is the flavor of credentials for today that you would recommend? PMP is still pretty important. Is there anything else you would highlight or emphasize?
I think it depends on what you do, right? It depends on your profession. Healthcare is a broad industry. So if you're an IT person, and depending on which part of IT you're in, yes, some credentials tend to cut across a large number of roles, like the PMP does somewhat. But there are others. But I think you should think about where you want to go professionally speaking. And I've used certifications strategically. I'll give you an example. When I was thinking that my next role was to be a CTO and to run all of infrastructure, I saw a gap in my experience, right? I said, okay, I've done quite a bit with Unix administration. I've done Windows administration. I have some certifications to show that I know a thing or two about project management. The one thing I had not done was manage a network engineering team or work as a network engineer. And so I decided, you know what, I need to, study about that. And I've found certifications my best way of studying, because when I take the curriculum from a certification program and I begin to study to that, it gives me the discipline and the structure to study. So I went after the CCNA, and I'll tell you, that was my 14th certification exam, and that was the only certification exam that I failed. I had done 13 up to that point, and I passed them. So my winning streak was broken by that. But despite the fact that I failed the CCNA Certified Network Associate certification, the fact that I studied for it, because I was a full-time, managing multiple departments at MSK, I had my hands full, and I didn't really have the time and energy to study for it as I would normally have. But I still was able to learn enough to give me both the confidence, to think that I could manage network engineering function in my next role, and even in my interviewing for the opportunities that came subsequently. I wasn't afraid that I would not be able to speak to that important part of infrastructure. So while I was unhappy that my streak got broken by that exam, I still learned enough in the process to be able to interview well and get the job that I wanted, to be overseeing all of infrastructure. So certification, I think, tailor it to where you want to go. You know, either what you're doing right now, if you think that would make you a better engineer or a better accountant or better whatever in what you're doing, but also think about where you want to go next and how that certification can facilitate your stepping into that next level or the level beyond that.
I love that. And Chif, would you provide feedback on that one as well?
Sure. I think Bashir hit the nail on the head. Be intentional about what you're doing with it. And you, Russell, actually gave a very good example of another way of doing this is once you get assigned to a net new project, figure out what is the credential for that new skill that you're acquiring. I found personally that it's actually also very helpful. At one point in my career, I'm not a biomedical engineer, but I was tasked to lead biomedical engineering. And one of the first things I did was pick up a book and say, what is biomedical engineering? Because I didn't understand what it meant, but it was a job that I was given. And then while I was getting my feet wet managing that team, in the first 6 months, I took a certification from their body, AMI, to be a certified biomedical engineering technician. Now, the whole purpose of that was for me to understand what they did and get credibility. So I think you use your certifications to either A, put credibility to the experience that you're getting, and also B, create a pathway and give you that structure to study for where you want to go.
That's great. And then this goes back to Christine's question. Can you recommend any opportunities for training online or through community organizations if you don't have access through the institutions mentioned? So one of the ones I put in there is udemy.com. They're basically instructor-led training that you can sign up for. My mentee actually learned some coding on there and actually got a job coding. So I was really, really happy with his work for doing that. LinkedIn Learning is actually a really good site as well. So LinkedIn Learning does a couple things. One, it gives you access to a host of training, but it also increases your capability for LinkedIn so that you can actually interact with recruiters better. So again, this is another thing where you're arming yourself for your success. edx.org, thank you for sharing. That's another good one. Any others would the team recommend? Either you can put them in chat or any of our
YouTube
presenter?
YouTube is a great platform.
YouTube, yes, let's not miss the obvious one of YouTube.
Yeah.
That's great, but I think the important thing here is keep learning. Don't let barriers get in your way. I don't know if you guys know, there's a thing called libraries. They have a lot of books online now. So cash is not always a barrier to learning. So you take an effort, people will see that effort.
And Russell, actually many companies, particularly technology companies, do offer free training on their sites.
Oh, absolutely.
Amazon offers tons of content on their site, and then they also do live trainings that are no charge. Many companies do that. So I think we should not forget those as well.
And if you actually still like to go to a place and learn, a lot of your local colleges or your community colleges still have continuing ed programs that, yes, some of them are free and some of them there might be a financial outlay, but that's also something that people could do if you want to do, if you still want to see people.
And invest in yourself. That's I don't know if you've listened, but each time our two presenters have talked, it's learn, grow, learn, grow. It has been a consistent theme throughout. So Ralph Thomas asked the question, as future leaders, how will AI machine learning change how we lead our department's facilities and how soon?
Well,
go ahead.
Sure. I think I will share a bias. The first computer science class I took was AI, and that was in the early 90s, right? Hold on one second.
I'll go while you you take care of that. So AI is here today. Machine learning and AI, it's here today. It's in healthcare. It's a big part of how care is being planned in many organizations today. Many organizations, many hospitals today have really beefed up their data analytics platforms, and they're using machine learning. They're using natural language processing to improve, for example, even things like revenue cycle, and improve our collections, in mining clinical documentation. So I would imagine that if someone was thinking about, which are some I'm addressing maybe the younger professionals now who are thinking about areas to focus their learning and development on. Machine learning and artificial intelligence are very powerful growth areas, and people that have skill sets in those areas and that can map those skill sets to your specific domain. So if you are a clinician or someone that works in healthcare IT, and you also have training in AI and machine learning, then that really is a good combination of skills to bring together. Chif, I'll let you continue the story.
Oh, thanks, Bashir. And I wish there was an AI app that kept the kids away. So the one thing I'll say is, like, throughout the career, beginning of my career, one of the first books I did was AI. And, the concept was AI was going to take over the world. That was, I want to say, 15 years ago, 20 years ago. We're still saying AI is going to take care of the world. Alan Turing is considered the father of artificial intelligence. He said this in the 50s, AI is going to take over the world. Now, I think one of the things that we forget is we've had so much incremental improvement in how we use technology, and there's so much incremental improvement in the intelligence of our tools and the insights that we gather, that I want to caution people, when we think AI, we're thinking, I don't know, Terminator or iRobot type of an AI tool. It exists in terms of automating incremental processes. And now that we're generating several reams of data and we're being able to catalog all that data, the key thing is, how do we leverage all the information we're gathering, and how do we turn that data into actionable insight? It has to be actionable. It has to be, if it's not actionable, it's just data for the sake of data. So when we think about how it's going to improve healthcare, we have sensors, we've had medical devices for decades. Each one of them is capturing reams of data, of information about a patient in a bed at that moment in time. We have EHRs that are getting better connected. We have personal health records that are getting better connected. We have cell phones that are generating data. We have a conglomerate of data sources. The opportunity is insight. How do we tell that to tell a story to predict when the next heart attack is going to happen? And more importantly, what do we do to stop it? Or how do we do to predict that whatever event is about to occur, and what is the preventative action that we can do? So that's where I think there's going to be opportunity, both in learning about how to understand and aggregate data and do the precision with it, but thinking in particular, what is the problem we're trying to solve? Back to the concept about project and what's the goal and what are we measuring? What's the problem we want to solve, and how do we turn that data into insight?
I think that's great. So speaking of data, I know, and knowing where we are from a time perspective, I'm going to grab like 2 more questions, and then we will conclude the Q&A at 7:30. Please continue to put the questions in the chat. As you know, anything that you write down, we can always find later. So, there's no reason to stop just because we are not going to be in front of each other. So it's again the same theme. So I'm going to see if I can summarize 2 questions, and I'll give it to both you gentlemen. What technology changes do you envision going forward with the increased cases of COVID? And then I put that against the interest of AI in health and wellness and in digital health. So I'm kind of combining a couple of questions into one.
So the obvious one is virtual care, right? we've had a good taste of telehealth and virtual care, and with what happened over the spring. So we know we can do it, and all those physicians that were reticent about embracing the technology, they've long overcome their reticence and are now, good advocates of the technology. So we know that that's here to stay. We know we can do it. We have the capability and it works. And we anticipate that that would continue. Now, of course, there are challenges with that. The reason we were able to do telehealth so well, one of the reasons we were able to do it so well during the pandemic was because the government relaxed the reimbursement rules around telehealth, were adjusted to allow telehealth to be used. If a physician does not have to be licensed in one state to see a patient somewhere else. Some of the restrictions that were there before were lifted temporarily. Now, hopefully, those restrictions would be lifted permanently, and we can continue to enjoy the same kind of freedom to use those services. So that's going to be there going forward. Of course, the constraints of the disparities that we talked about will remain. I also imagine that for us, again thinking as an infrastructure person in IT, there's a shift from where the bulk of your workforce is on-prem at wherever your company is, to now a true digital workplace. We've been talking about the idea of a digital workplace for a few years now, but no one really paid too much attention to it. Now we're seeing what a real digital workplace is. And that's the concept of people being able to do what they need to do wherever they are. So a doctor could be at his home, in the suburbs, seeing patients in their homes wherever they are. And if the patient does not need to come in for admission or for some exams, then they don't need to come to our facility. Employees are largely at home in many organizations now, and the same thing in many of our departments in healthcare institutions are temporarily or permanently off-site. So those are so it's putting a strain, or not a strain as such, but it's changing. That's a better way of saying it. It's changing how we present and support technology, because now we're having to support people in their homes. People took home machines. Now they have problems at home when they cannot connect. We're not sure, is it your home Wi-Fi? Is it because you have many people in the home watching videos, watching Netflix, taking classes, doing whatever? So it's changed how we implement some aspects of our technology and how we support those. And I think at the end of the day, we will come out of the pandemic much better as care organizations, and for those of us in technology, much better as technology service departments.
My take is technology will do what technology does. It will always get better, faster, more accessible. One of the things that I think we should begin to think about is the people aspect of all the growth. So as technology continues to get better, faster, more access, we can do things. Now there's, how do people adjust? So if you think about the way we network, think about what water cooler conversations that were a great opportunity to meet people at work are gone. What the technology is doing is we're a remote workforce. How do we begin to adapt as people to working remotely and maintaining our efficiency? The other challenge that I think it's less on the technology is the rules of engagement are going to change. Right now, most of our local employers like to hire local talent. Once this becomes ubiquitous, which it's about to become fully, all of a sudden, local talent is not as attractive, because if you're in the New York area, you're quite expensive versus your colleague who might be in a rural area. So It'll be very interesting. Bashir talked about reimbursements. So we relaxed the rules, but if you think about the way our providers are licensed, they're licensed by state, and they pay a fee to maintain their license by state. Once we get to that ubiquitous platform, how do we begin to adjust our regulations to keep where we are? So it's amazing. Everyone thinks about the technology as the challenging thing. I think the people and how we operationalize and adapt to the technology over the long term is going to be fascinating. And I think that's where the true challenges will be. Once we get out of the pandemic mode and everybody wants to revert rules, it'll be very interesting what rules revert, HR laws change, those types of things. And the good news is we'll all be there to watch it. So.
Well, that's great. I'm glad we're all there to watch it. Thank you guys for letting me moderate for you. So I'm going to turn it back over to who's taking it now?
Jay Fergus. That would be
all right. On to you. Thank you so much.
Thank you. Absolutely. Can we just do a quick reaction clap through Zoom on this fabulous panel and moderator Russell, Bashir, as well as Chif, doing an amazing job. Really enjoyed it. Thank you so much for this amazing program. And thank you everyone for attending. I know we are all Zoom fatigued at this point, which is why we really appreciate you attending tonight. I want to close actually in the chat room with some useful links, just some very quick information about future events coming up. That's our event page link, as well as an email address in the event that you have questions, you want to know more about programs that we do, the things that we do, you want to know more about NAHSE New York Regional. These are the links for that. And basically, just again, thank you again, Bashir, Russell, Chif, for enriching us with their knowledge and experience. We hope this program was meaningful and informative and useful for you. And that is pretty much it. If you have any more questions, I would like to close by saying, have a good evening.
Thank you.
Absolutely. Thank you everyone for attending. Are there any more questions? Nothing else before we close? Excellent. And by the way, just in case anyone doesn't know, I'm Jay Fergus. I'm the future president of New York Regional 2021-2023. I'm putting the plug in for me. This is my first time closing, doing future planning, and I definitely will be staying in touch with Russell, Bashir, and Chif for future opportunities to do these types of presentations. I found this extremely informative, and I hope our members and our guests did as well.
And I'll say one thing before we go. Feel free to connect on LinkedIn. Networking is part of career development. Feel free to connect on LinkedIn, and awesome. We'll help each other anyhow we can. Thank you.
Fantastic.
Absolutely.
I will definitely do that. Absolutely. And we will also be following up with our guests and our members as well via email as well for everyone who attended tonight. Thank you so much, everyone.
Good night.
Good night.
Perfect.